Hello, I'm Laura Heydrich with the Pain Cure Clinic, where we teach people how to cure chronic pain. And check out our free guide on how to diagnose tension myositis syndrome. You can find the guide via the link below. Okay, so today I'm going to focus on one of Dr. John Sarno's books titled Healing Back Pain. If you haven't read it yet, or haven't read all of it, or even if it's just been a while since you picked it up and you need a refresher, I'm going to share 5 key points from this book about the mind-body connection to chronic pain, a sort of Cliff Notes version, if you will. So let's dive in with key point number 1. If structural abnormalities don't cause pain in the back, neck, shoulders, etc., what does? Studies, as well as Dr. Sarno's clinical experience over many years, suggest that these common pain syndromes are the result of a physiological alteration in certain muscles, tendons, ligaments, and nerves. Yes, nerves as well. Sarno calls this physiological alteration Tension Myositis Syndrome, or TMS for short. TMS is a harmless but potentially very painful disorder that is the result of specific common emotional situations. Dr. Sarno's purpose in writing Healing Back Pain was to describe TMS in detail. Now moving on to key point number 2, which is the role of fear in TMS. The severity of TMS is measured not only by the intensity of the pain, but by the degree of physical disability that exists. What things is the person afraid of or unable to do? Disability may actually be even more important than pain because it defines the individual's ability to function personally, professionally, socially, and athletically. Sarno goes on to say that in the long run, fear and preoccupation with physical restrictions are more effective as a psychological defense than pain. A severe attack of pain may be over in a few days, but if the person is afraid to do things for fear of inducing another attack, or because he has found that the activity will invariably bring on pain, even if it's not an acute attack, then the preoccupation with the body is continuous and the defense is working all the time. Most people with TMS are afraid of physical activity to one degree or another, which tends to perpetuate the problem by inducing further anxiety and often leads to depression as well. Let that sink in for a moment to really understand how fear and emotion can keep you trapped in a chronic pain and anxiety cycle. If this resonates with you, then a mind-body approach to curing your pain makes total sense. Key point number 3 from the book Healing Back Pain, and related to key point number 2, is a fear of physical activity. Perhaps the most important but most difficult thing that patients must do is to resume all physical activity, including the most vigorous. This means overcoming the fear of bending, lifting, jogging, playing tennis or golf or any other sport that you enjoy. It means unlearning all the nonsense about the correct way to bend, lift, stand, lie in bed, swim, what kind of chair or mattress or desk to use, the best shoes, brace, or back cushion you need to be comfortable, and many other bits of medical mythology. I love the term medical mythology. This phrase really captures the idea of a collective consciousness that's developed around chronic pain and its treatment that must not be questioned. Key point number 4 addresses discontinuing all physical medical treatment. Sarno says that another essential for full recovery is that all forms of physical therapy and medical-related treatment must be abandoned. And Sarno also includes treatments that are not strictly medical, such as acupuncture. The principle behind this requirement is that one must renounce any structural explanation either for the pain or its cure. Otherwise, the symptoms will continue. Exercise, and we would add body work, such as non-medical massage, for the sake of good health and feeling relaxed, is another matter and is strongly encouraged. We find that the role of physicality in healing chronic pain is often misunderstood by our coaching clients. What Sarno is saying, and what we found to be true for ourselves and our clients, is that you have to stop medical treatment that hasn't worked to resolve your chronic pain and never will. Start moving and caring for your body again, just as you would to be healthy in general, while also working on your tension and any ongoing stressful life circumstances. It all works together, and that's the formula that works time and time again. And finally, key point number 5 regarding treating chronic pain. In a nutshell, Dr. Sarno says that treating pain is not, in fact, medically sound. Pain is a symptom, like a fever. Chronic pain has been elevated to the status of a separate disorder on the hypothesis that certain psychological factors cause the patient to exaggerate the pain. But you see, this theory requires that one acknowledge the continuing presence of a structural reason for the pain, which just doesn't hold water. Pain is, has been, and always will be a symptom. If it becomes severe and chronic, it's because what's causing the pain is severe and has gone unrecognized. Chronicity, then, related to pain syndromes, is a function of faulty diagnosis. That's right, friends. The chronic pain loop typically starts with the wrong diagnosis, or more than one diagnosis, as you search for a medical explanation for your pain when there isn't one. This path only leads to wrong treatments and continued pain. But you don't have to live this way any longer. At the very end of the book, Healing Back Pain, there are a number of letters that Dr. Sarno received from grateful patients who had indeed healed their chronic pain. During his tenure as a TMS doctor, he helped over 10,000 people get rid of their chronic pain. Dr. Sarno may have physically left this earth in 2017, but his TMS diagnosis and approach to getting better live on. Thank you, Dr. Sarno. It's an honor to help keep this flame burning. That's it for this episode. For more information about our coaching products, visit paincureclinic.us. Thanks for watching.